How do I know if I'm a candidate for hair restoration surgery? And the answer to that question is you really need to come in for a consultation, because what we need to do is we need to do an evaluation on your scalp and see if you have androgenetic alopecia. And during the consultation process, we will do some testing and we'll evaluate your scalp, and we can discuss what your expectations are and determine if you really are an appropriate candidate for surgery. Why do I need to avoid aspirin, alcohol, and certain supplements prior to surgery? And the reason for that is that it increases your tendency to bleed. And what can happen if you're bleeding is that we make tiny holes and we place the grafts into those holes. If you're a bleeder, the blood can actually push those hair grafts out of their hole. Can I drive myself to and from surgery? And I really prefer that somebody drops you off and picks you up from your surgery. And the reason for this is you may require medications to help you relax or medications for pain. And these would inhibit your driving ability. How long does the surgery take? And in my practice, typically for 1,000 grafts, it's going to take 4 to 6 hours. For 2,000 grafts, it's going to take 6 to 8 hours. For 3,000 grafts, frequently we'll bring in additional techs. So again, it'll take anywhere from 6 to 10 hours. Does the procedure hurt? In my practice, what we do is we do local anesthesia as well as anxiety medications and pain relievers. So we try to make this experience as pleasant as possible for our patients. What type of anesthesia do I use? And in my practice, we use local anesthesia for this procedure. So you're not under general anesthesia or under conscious sedation. How soon can I resume normal activities? I recommend that patients wait 10 to 14 days to resume heavy exertion. However, within a couple days, people can resume normal activities. How soon can I cut or color my hair? For cutting your hair, I would wait until the sutures are removed, which is 10 to 14 days. For coloring, I recommend that you wait for 3 weeks. How soon will I see new hair growth? Typically, the hair will start to grow at about 2 months. The hair grows at about 1/2 inch per month, so it will become visible at about 6 months to 1 year. Will the scar be visible? With follicular strip grafting, the most common procedure, there will be a very small scar on the back of the scalp. If you keep your hair longer than 1 centimeter, this scar will not be noticeable. For those people who are really concerned about scarring, you may want to consider follicular unit extraction, where the scar is less perceivable. How long does a hair transplant last? The hairs that are harvested from the back of the head are permanent. They're not sensitive to the hormone that causes hair loss. So the best part is the results of this procedure are permanent. How much does it cost? In my practice, we offer very affordable pricing so that people will get a great value for their money. Is hair transplantation covered by insurance? Hair transplantation is considered a cosmetic procedure, and as with other cosmetic procedures, it is not covered by insurance. We offer Care Credit, which is a national organization. They offer financing for health and cosmetic procedures. It's a great option for people who would like to do financing. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.